Welcome back to Florida Pediatric TV. We are filming this at the end of the second week of the 2014 legislative session, and I'm delighted to have with me today Doug Bell, who represents us in front of the Florida legislature. Doug, one of the issues that pediatricians have tried for the last several years is the booster seat. I think the last I checked, we're one of 2 states who have failed to update their booster seat laws. Where does that stand at the present time?
Well, Louis, thank you. It's a pleasure to be here as well. There are, in the Senate, there are 2 bills filed, but there is one really that is getting traction, and that is Senate Bill 518 by Senator Flores from South Florida. And that bill has been amended to alleviate some of the concerns by some senators, but it's now gotten through 2 of its 3 committees. And in the House, Representative Petery from Gainesville is the sponsor. And the bill has not yet been heard in committee, but we believe that some of the behind-the-scenes work has alleviated some of the concerns of the House members there, and the bill number is 225 there. So while they still have a good ways to go, I think that things are looking good now for ultimately a successful session on that issue.
Terrific. Another issue that the feds have allowed is for legal immigrant children to be enrolled in the Esq program, or Healthy Kids as it's commonly called in Florida. I know that legislation the last couple of years was unsuccessful. Where do we stand on that this year?
Well, in the House, you have House Bill 7 by Representative Diaz from South Florida, and that bill has been heard by 1 committee, and that was about a month ago. It has 2 more committees to get through in the House before it reaches the floor. In the Senate, Senator Renee Garcia from South Florida also has Senate Bill 282, and unfortunately that bill has not yet been heard. I know that there were some concerns in the Senate about this bill, but both of them have a good ways to go, to be honest.
And another issue is presumptive eligibility. The Affordable Care Act says that hospitals will do presumptive eligibility for Medicaid, for presumably Medicaid eligible kids. And that was to have begun January 1st, 2014. That required that the state of Florida issue some rules under which that would operate. But apparently those rules are out there, they're not acceptable, and so there's more negotiation going on. So unfortunately, that has not started. Another area in presumptive eligibility is allowing federally qualified health centers and other designated entities such as health departments to do presumptive eligibility for KidCare. And there had been legislation last year for that, and I believe there's at least 1 bill this year.
That's correct. Representative Gail Harrell is the chair of one of the healthcare subcommittees, has filed that bill in the House. We've not seen any similar legislation filed in the Senate. It's possible that it would come in a committee bill, but that bill that Representative Harrell has filed is 917. It has not yet been heard by any committees.
So not sounding good at this point in the session.
Right.
There's been a lot of interest in the child welfare system, particularly after there were a lot of deaths in foster kids and so forth. And so I think there's several pieces of legislation that address that this year.
There are, and as you know, we worked over the summer on an issue dealing with co-sleeping and met with the Secretary for the Department of Children and Families and met with some of the senior leadership from the Department of Health on the issue, where we wanted to make sure that all of the deaths related to co-sleeping were reported to the Child Abuse Death Review Committee. And as a result of that work, I believe there is language in both the House and the Senate bills that would require that all deaths reported to the Child Abuse Death Review Committee will be reviewed, as opposed to some being reviewed and some not, based on whether they are verified or not. So on that issue of co-sleeping, I think we're in a good position, And in the Senate, the bill that language is in is Senate Bill 1668. And in the House, the language that the bill is in is what's called a proposed committee substitute, or a proposed committee bill. The second issue related to child welfare that we are working on deals with the review of medically complex children and whether the child protective team or the medical director of the child protective team is required in all cases to consult with a specialist. And we have been working with the committees and with the various chairmen of the committees on that language to be sure that it takes into consideration the difficulties of doing that and the cost related to that. So that's a second piece that we are working on. And then the last piece that we're working on all the child welfare legislation is trying to make sure that we include some language requiring coordination with the statewide medical director for child protection. That unfortunately is something that's not already in the statute. Now that we have this opportunity, we want to get that in. And again, in the Senate, there are 3 bills dealing with the global child welfare, and those are 1666, 1668, and 1670, whereas in the House, it's all wrapped up in the one proposed committee bill.
Working with Interim Secretary or Acting Secretary Jacobo has really been a refreshing change, and certainly in the meetings we had during the summer, she was really very straightforward and wants to resolve the child welfare issues, and so hopefully some of this legislation will get through. I think one of the issues for those who deal with the child protection teams has been that heretofore Florida has not reported all of the deaths, only those that are verified, as you pointed out, and I was unaware of the great complexity of verification and why there are good reasons why some of those might not be verified, but that doesn't mean they don't need to be reported. So if you don't have the accurate total numbers, it's very difficult to do anything about like co-sleeping deaths and so forth. And certainly DCF has been extremely transparent and come forward and wanted to help to address those issues. An issue that's very much on pediatricians' mind right this minute is the meaningful use dollars for the electronic health records. ACA put out a notice recently that they had expended all of the dollars that they had allocated for those pediatricians who attest to meaningful use. Where does that stand?
Well, the issue we're dealing with there is the spending authority. The federal money is here. It's just that the agency does not have the authority. So they need that authority from the legislature. And we're looking at 2 different time periods. One is for the current fiscal year of 2013-2014. And based on my discussions with the Healthcare Appropriations Chairman as well as the staff directors for the big appropriations committees, it looks like there is interest in increasing the spending authority, and the way that they're contemplating doing that is putting some language in the back of the appropriations bill that they're currently working on. And if that's the case, the governor should sign that bill sometime in late May or early June, and then at that time, upon his signature, is when that new spending authority would go into effect. And that, of course, is a separate issue from how much spending authority will be authorized for the upcoming fiscal year of 2014-2015, which again is another issue we're working on.
So the thumbnail sketch on that is that Florida actually has money in the bank to pay physicians who have attested for the current fiscal year, which ends July 1, but they were short on spending authority because I believe the whole EHR issue was oversubscribed, or there were more people who signed up than they anticipated. So there are dollars there, but the spending authority is lacking, and so the effort is to get something before July 1 to allow spending authority for the dollars that are already there.
Yes, that was very well said.
And then once we get to July 1 and beyond, we're into the next fiscal year, and that should be a part of the budget as it goes forward.
Yes, correct.
Another issue that's on everyone's mind, and I thought that I would just try to update our members, is the Affordable Care Act Medicaid physician fee increase. And as you know, the Affordable Care Act required that physicians be paid at the Medicare level beginning January 1, 2013, provided they fit into one of certain categories. And there was about a 6-month delay in implementing that for the fee-for-service program in Florida, the so-called MediPass program. The big problem at the moment is very few of the Medicaid HMOs have started paying at the new rates, and the 2-year Affordable Care Act increase ends at the end of this year, so December 31, 2014. And so efforts are underway at the present time to have a conversation with the Medicaid agency, ACA, about stepping up the Medicaid HMOs honoring what the Affordable Care Act requires. And then another question that I frequently get is, what about the kids on SCHIP or Title 21 or so-called healthy kids? Unfortunately, the Affordable Care Act did not address them specifically. The Affordable Care Act said that Title 21 kids or SCHIP kids are not included in the physician fee increase, but that the individual states could, out of their own general revenue dollars, provide dollars to increase that. At this point, we've had some conversation with Healthy Kids Corporation. There seems to be little interest in doing that. So unfortunately, the SCHIP kids remain at the old Medicaid rates. There are also a number of CMS issues that have arisen as a result of the statewide rollout of Medicaid managed care. And as everyone knows, Medicaid managed care rolls out in May, June, July, and August, depending on what part of the state you're in. And then CMS is supposed to become a managed care entity as of August the 1st. And our understanding is that CMS would operate through 2 ICNs, integrated care networks, one in North Florida and one in South Florida, and that then physicians who see CMS kids would need to be providers for one of those 2 networks. Our understanding of the problem is that CMS doesn't currently have a contract with Medicaid for that, and yet there are 70,000 kids in the CMS network, and we have a lot of concerns about what's going to happen to those kids when August 1st rolls around. We're getting lots of questions from parents. So we have a meeting set up next week, or later this week actually, with officials from Department of Children and Families, from Children's Medical Services, and from the Agency for Healthcare Administration, hopefully to answer some of those questions. Another big issue is that right now, the way CMS operates, a child can be in CMS with a special healthcare need and receive the case management services, et cetera. Yet they might also be in a PPEC, Pediatric Prescribed Extended Care Facility, and under Medicaid managed care, we're being told that, I'm sorry, the kid has to choose one or the other. They can't be in both. And unfortunately, I don't think that fits the needs of the children. So one of the issues we hope to begin discussing later this week is how do the kids get in the right buckets when they have a special health care need, as opposed to being limited to one or the other of the several buckets that are out there for children under the Medicaid managed care rollout. So more to follow on that topic. Another issue that I wanted to update everyone on is our Medicaid lawsuit. As you know, we filed suit against Medicaid back in 2005 in federal district court in Miami, charging them with failure to assure that children covered by Medicaid actually have access to health and dental care as required by federal law. That suit went to trial in Miami in December of 2009. The trial ended in April of 2012, and we continue to await a ruling by Judge Jordan on that. The two issues that were, we asked the judge to give relief on were, number one, the payment levels for physicians and dentists were inadequate to allow children to actually access care. And secondly, there were a host of administrative barriers that prevented parents, children, and physicians from being able to access care, not the least of which was the big problem with switching, which continues to go on, the lack of outreach for the KidCare program, the complexity of the Medicaid application, et cetera. So we continue to await a ruling. The Affordable Care Act physician fee increase did provide some relief, but only for certain physicians, and didn't provide any relief for dentists, and unfortunately is time limited. So as time goes by, it becomes even more important for us to eventually see a ruling from Judge Jordan. The other lawsuit that the Florida chapter's been involved in is that about firearms. And as you know, in 2011, the Florida legislature passed and Governor Scott signed a bill that basically said that we were not allowed to ask parents about firearms in the home. We sued the state, and in federal court in Miami again, this time Judge Clark ruled that the law was unconstitutional, that it violated physicians' First Amendment rights to discuss these issues with parents and patients. Governor Scott has challenged that in the 11th Circuit Appellate Court. There was a hearing last summer about that, but no ruling has come forward. So for the moment, Judge Cook's ruling stands. That law is unconstitutional, and it is absolutely okay for physicians to ask parents about the presence of firearms in homes. And Doug, back to legislation this year, there are some bills regarding scope of practice, and some of those are of interest to pediatricians, and I wonder if you could summarize where we are on that.
Well, the House has put together a select committee on healthcare workforce in an effort to address what is viewed as the lack of access and the lack of professionals to provide care to Floridians. And the House's, their approach is to expand the scope of practice for nurses and allow nurses to practice independent of physicians. The Senate is not inclined to take that same approach. However, there is a bill in the Senate, which is 1352 by Senator Grimsley, which would allow nurses to prescribe controlled substances. And the bill that I referenced in the House is 7071.
Okay, very good. And then originally lumped together but now separated out, there are some bills related to use of telemedicine.
There are, and a number of bills were filed at the beginning of session, but the two bills that have gotten some traction and been heard in committee is House Bill 751 by Representative Cummings out of Clay County. And that bill still has a couple of more committees to get through. One thing of note in this bill is, in both bills as a matter of fact, they allow out-of-state physicians to practice in Florida via telemedicine without getting a license in Florida. There is I think a minor certification process where they need to sign up with the department, but not be licensed in Florida. So that is a concern for the FMA and something for us to watch. In the Senate, they're taking a similar approach, and the Senate bill is 1646 by Senator Bean. He's the chair of Health Policy, and that also has a couple more steps before it's taken up on the floor. So those issues seem to have a ways to go. There has been a lot of dialogue, though.
And Lastly, there are some budget issues within Children's Medical Services of interest to several of our members.
Correct. The first issue that we've got on the list here is one, it's an item that was within the governor's proposed budget, and that is to increase funding for the top child protection teams, the CMS contracted staff for the child protection teams, and that is a $2.8 million request. And in the meetings that I've had with the various chairmen and their staff directors, we do seem to be getting some interest and some traction on that issue on both sides, in the House and the Senate. The next issue on the list is an issue dealing with transition care. I view it and kind of describe it as a regional expansion of the Jack's Hats program, and that's a $400,000 request. And unfortunately, there's not been much interest in terms of the House and Senate leadership on that issue. And then the next issue is additional funding for the various pediatric cardiac facilities around the state, and that is a $3 million request. And we do have some interest, and we seem to be getting some traction in the Senate on that one, with Senator Aaron Bean as kind of our champion on that issue.
And finally, I wonder if you'd make a couple of comments about the importance of our members to contribute to the Political Action Committee, known as PDPAC, the Pediatric Political Action Committee.
Well, I think it's very important. Unfortunately, unfortunate or fortunate, however you view it, but money in terms of contributions is a very important part of politics and campaigns these days. And until the Supreme Court makes an alternative decision, it's just there. And in order to play at a high level and have significant access to legislators in order to speak with them about the policy and about the issues, fundraising is key. So I think anything that the membership can do to contribute to the PDPAC is very important, and I would encourage that.
Doug, thank you very much.
Well, you're welcome.
That's it for this week. We'll be back next week with an update on the third week of the 2014 legislative session. As always, let me know if you have questions or if there are additional issues you would like for us to discuss.